afternoon, and on behalf of Chicago Public Library, thank you for joining us this afternoon. We are so happy to have the knowledgeable experts from Rush Alzheimer's Disease Center with us for today's program, Resiliency and Coping for Dementia Caregivers. There will be a Q&A portion to today's program. Whether you are watching us on YouTube or Facebook, please type in your questions and we'll see them and ask them to our experts after the presentation. Today's program will also be saved on YouTube, so you can watch it again or share it if you'd like to. So now here's Dr. Sanchez-Johnson to get us started.
Great, thank you so much for joining us today. So I am Dr. Lisa Sanchez-Johnson from the Department of Family Medicine at Rush University Medical Center in Chicago, and I am a clinical health psychologist by training, and I help to oversee research in our Department of Family Medicine and especially focus on health equity issues. And I'm very pleased to be here with my colleagues here from the Rush Alzheimer's Disease Center. Especially pleased to share with you what we have planned for you today. I love the title of our talk today, which is Resiliency and Coping Strategies for Dementia Caregivers. And I will have Sophie Sepura start us off this afternoon. She is a clinical research assistant, for the All of Us research program at the Rush Alzheimer's Disease Center. She's going to start us off, and then we're going to head to Elizabeth Franco, who's also a clinical research assistant with the All of Us research program at Rush Alzheimer's Disease Center. And then finally, we'll have Michael Pessman join us, and he is a community engagement coordinator at the Rush Alzheimer's Disease Center. So really nice group of people joining us today. We're very pleased to be here, and I will assist with the discussion part along with Sophie Sepura. So with that, if I could just turn it over to Sophie.
Yeah, hi everybody. First of all, thank you so much, Dr. Sanchez-Johnson, for that introduction. As she mentioned, my name is Sophie. I'm a clinical research assistant for the All of Us research program. And to be able to join this and speak about Alzheimer's disease is particularly meaningful for me because I watched my grandfather battle Alzheimer's, and he was very dear to me. So it was really difficult, but it did open me up to the phenomenal work of dementia caregivers and inspired me to later become one. And it led me into clinical research where I hoped to see medical breakthroughs be made, such as the one for Alzheimer's disease. So thank you all again for joining us today as we begin to talk about this disease and hopefully help open up the discussion on coping and the significant effects on both those diagnosed and their loved ones. And before we begin, if we can go to the first slide. Perfect, thank you very much. So before we begin, as I was saying, I just wanted to quickly touch on some of the things we'll be going over, such as some of the facts and figures behind the work of dementia caregivers. Recognizing the common signs of caregiver burnout, since an increased need for assistance usually comes with the progression of the disease. And during this time of the COVID-19 pandemic, especially, when there's been such a significant disruption in routines, it's become even more common for our caregivers to feel overwhelmed and burnt out. So we will be going over some tips and coping strategies for our caregivers, as well as the resources available for support and connecting with other caregivers. And we'll also briefly share some of the research studies being done against the fight against dementia and Alzheimer's. And we will be setting aside time for any questions that you might have in our Q&A session at the end, or any thoughts or experiences that you might want to share with the rest of us. And we can go to the next slide, please. Thank you. So after this presentation, our hope is to not only shine a light on the work of our caregivers during this pandemic, but to especially increase awareness about the need for caregiver support and those tips and coping strategies that are being recommended to caregivers. And we will also go over the importance of medical research during this time. And as I mentioned, we'll also be opening up the room for a Q&A at the end of this, just to give everybody a chance to share their voice, ask questions. And please also feel free to use the chat box to your right to write any questions or thoughts as we go along, and we will be sure to address those at the end of this. We can go to the next slide, please. And I will be introducing the next speaker in a moment, but we wanted to really take a moment to also acknowledge those of you who are in the audience watching, whether you're nurses, nursing assistants, family members, friends, helping with your loved one. You are all caregivers who are doing so much of the work that many, many people cannot. And considering that there are more than, I believe, 15 million Americans currently living with Alzheimer's disease today, this means that there are also equally 15 million family members, caregivers, who are also impacted. So with that, I would like to introduce my colleague, Elizabeth, who will be sharing more about caregiver burnout and the coping strategies available.
Thank you. Well, today I'm very happy to be able to share all this information with all of you, because as many of you, I have family members that are caregivers, and they are giving all their love and their service and all that they have for these persons that they are taking care of. So thank you so much to all of you that are taking care of somebody else from your family or otherwise. So I would like to start talking about some facts and figures about Alzheimer's. So in the slide that you will be looking right now, we can start reading some of those data. If we can, please show the slide. Thank you. And the next one, please. Thank you. So nearly 15 million Americans provide unpaid care for those living with Alzheimer's or another dementia. The estimated population of Illinois for 2020, it was around 12.5 million people. So we can imagine that more than the entire population of Illinois, not just Chicago, are providing unpaid care for those who are living with Alzheimer's or another dementia. From those 15 million, almost 60% found to experience depression or anxiety. And this is normal because they are offering all that they have for these people that they love. And 23% are 65 over. So that means that 77% are younger than 65. And that's not quite old. So we can imagine that young people are suffering for all these circumstances that they are living. And 32% miss their own doctor's appointments through caregiving. Sometimes they need to decide if they prefer to take care of their loved ones, to go to visit a doctor, or to visit a doctor for themselves. Also, the dementia caregivers are 7 times more likely to experience daily physical, emotional, and mental exhaustion from caregiving, and 3 more times to feel extreme stress from their responsibilities than other caregivers. And this is because their needs of those who are living with dementia change every day. And finally, we can say that 17.5 billion hours are of unpaid caregiving in the United States. If we suppose that every hour it's paid to $13, we have an amount of $227.5 billion. With that amount of money, in 2014, a platform such as Facebook, where all of you are participating today, Facebook generated 4.5 billion jobs, just for you to have an idea. Okay, so now that we understand a little bit about the situation, we can move to the next slide. Thank you. So it is important that the caregivers can recognize some of the symptoms of burnout. And this is very important because we know that the health of their loved ones is very important, but also the health of the caregiver is very important as well. So what are the common signs of the caregiving burnout? And I will be just mentioning some of those. Chronic underlying worry or fear about their loved one's needs. And this will be changing, of course, depending on the time that they are spending taking care of somebody else that they love. Increasing anxiety or depression because they forget about themselves. They are giving everything to somebody else. So thank you so much again. We don't have words to really express all of our thankfulness to you. Decreased interaction or isolation from others. New worsening health problems. And this is normal. If somebody is suffering from anxiety or depression, it could be possible that they are experiencing headaches or stomach irritation or even some heart problems because of the anxiety and depression. Feeling of resentment, frustration about caregiving tasks. And again, maybe this is because of the situation of those who are living with Alzheimer and other dementia change every time or frequently. Difficulty sleeping, and because of that, daytime fatigue. Difficulty concentrating, forgetfulness, and mental fatigue. And finally, financial concerns from missed work and medical expenses. So this is a very hard situation for everyone. And we will continue talking in the next slide about the situation of those who are living with Alzheimer or dementia during this COVID-19 pandemic. And again, if you are watching us on Facebook and you want to write some comments or questions, we really want to hear from you because you are very important and we can learn from each other. So during this quarantining, many residents in quarantine memory facilities may not fully understand why their loved ones or other healthcare providers, they didn't visit them, or why their routine changed so fast and suddenly from one day to another due to the COVID-19 pandemic. And this situation is very stressful for them. So forgetting why they can go places also cause more pent-up stress. And this can lead to some behaviors such as passing, picking at the skin, compulsive behaviors, more sadness, and loneliness in unable to be with family, friends, or with those specific healthcare workers that they were taking care of them. And also increasing frustration with reminders about wearing a mask without understanding why. And in today's society, many people do not want to wear a mask. Now imagine somebody that is not really understanding why. To be with living with Alzheimer or dementia can increase the risk to get COVID-19, not because of the illness itself, because having dementia or Alzheimer, it doesn't mean that you can contract the flu, right? But it's because of their behavior, because they cannot understand or it's difficult for them to follow the CDC guidelines. So also it's difficult for them to protect, to be washing their hands, to be wearing their mask, or to be practicing social distancing. So this is the situation for those who are living in healthcare facilities or memory care facilities. And in the next slide, we will be talking about some tips for dementia care during this pandemic for those who are providing care at home, but also for those who are paying for some care services. And we have right now the opportunity to get the COVID-19 vaccine more easily. So it will be a good idea to get the vaccine for everyone, for the caregiver, and for those who are living with dementia or Alzheimer's. So for the first group, for dementia caregivers at home, one of the tips is to establish a new routine. Because during these circumstances, to change already their routine is very stressful. But we can make it more easier for everyone. So if those who are living with Alzheimer or another dementia, they are used to go out for lunch, we can organize a picnic in the yard instead, and more now with this beautiful weather that is coming up. And if they are used to go out for shopping, they can walk around the block. So those are some ideas. But if you have somebody who is living in a healthcare facility and they are used to visit, to receive visits, you can also organize visits through the window or to some platform like the phone with camera or Zoom, etc. It will be very important also to have extra reminders around your home to remember important hygienic practices, to remind how to wash your hands in a correct way for 20 seconds with water and soap, or to demonstrate to those who are living with Alzheimer or another dementia through hand washing. But if this is not possible, to have alcohol-based hand sanitizer available in different places around your home is a good option. And these reminders are important for those who are living with these illnesses, but also for the caregivers, because it could be possible that they can forget. They have so many things in their mind, and it's common that maybe even ourselves can forget these kind of things just once in a while, right? And also to mind your tone in spite of stress. So those who are living with Alzheimer or another dementia, those who are living with Alzheimer or another dementia, it is possible that they don't understand really well what is happening, or they have problems by trying to explain what they want. But that doesn't mean that their emotional memory is not working well, right? So they will be reacting depending on how their caregivers are talking to them. So if you are calm and you are happy, you also are assuring them that they will be okay under these circumstances. And you can plan ahead and make alternative plans for care management in case it is needed, in case you get sick, so you will not be very stressful because of the things that could happen. And ask your doctor about filling prescription for a great number of days to reduce pharmacy trips. So this is very important because we try to reduce the number of visits that we are having to the pharmacy, to the doctors, etc., and minimize the risk to contract COVID-19 or other illnesses, right? And finally, for those who are receiving in-home dementia care services, one of the tips is to contact the home healthcare provider to explain their COVID-19 protocols and to check the temperature of this healthcare provider. So anybody who is having more than 100.4 Fahrenheit temperature, they should not be providing services. And ask the healthcare professional to wear a mask. That is very important. And ensure that they are washing their hands frequently when they are in your home, especially before and after using the restroom, after eating, but also after coughing or sneezing. And I guess that we will be following these guidelines forever for our own being, right? Okay, we can go to the next slide. Thank you. So what are some of the tips for dementia caregivers? Make yourself a priority too. We know that you are doing the best that you can, and you are providing all your love, your service, and your care to somebody else. But you cannot do this if you get sick. So it is important that you also be healthy. So what are some of these tips? Stay socially active via phone or video. And in the internet, you can find so many friendly platforms to do so. Exercise regularly. Science demonstrates that when we are exercising our body, we can manage the level of stress in a better way, and things will be more easier. Reach out to loved ones. And for sure, all of us have somebody that we miss or we love, and we didn't talk to them in a long time. So maybe it will be a good idea to go through your directory in your phone and pick up a name and just send a text to somebody. For sure, you will make their day better. And when they respond to you, your day will be also better. Keep up hobbies. Hobbies are very important, and they will be allowing your mind to be busy. Try keeping a regular sleep schedule. That's very important. Find a local support group. The local support groups will help you to understand that you are not really alone, and we need each other in so many different ways. And also you will find some strategies and how to cope this situation in a better way. And Michael Pessman later will be sharing with us some of the local support groups and resources in the community. Another tip is to limit watching or reading the news. 70% of the news are negative, and it's not helping our mind. And if it's not helping our mind, probably it's not helping our body. So it would be a good idea to be watching the news just once or twice a day. And hopefully in the future, it will be programs with just positive news or just things that make us happy. Another tip is to eat a healthy diet. Vegetables and fruits are very good for our body. And also it depends on the things that we eat, our mood will change. So try to choose a healthy diet. And all the food that is good for your heart is good for your brain. Don't be afraid to ask for help. And thank you so much for joining us today. I hope you will continue joining these kind of activities that are very important, and include positive activities in your schedule. And this could be very simple things. If you like coffee, just try to go to a coffee shop just once a week. Or if you like ice creams, now that is more a better weather, you can organize yourself, your schedule, and go and get some of your favorite ice cream. So those are one of the tips that we have. And continue in that line for our next slide. So it's important, again, to make yourself a priority and to be realistic. The needs of those who are living with Alzheimer's or another dementia change over time. Accept changes as they occur, and don't worry. There are so many people that are going through this situation. And when you find a local support group or resources, this will be very useful. And manage your level of stress. You can find so many different videos on the internet that you can take advantage of that. And finally, know that you are doing the best. And again, thank you so much for provide your love, your care, and service to somebody else. And with this, Michael Pessman will continue with the resources. Thank you, Michael.
Thank you, Elizabeth. My name is Michael Pessman, and I'm a community engagement coordinator here at the Rush Alzheimer's Disease Center. A little background about me: I do have family members that are caregiving for a loved one with the disease. I like to, I have a degree in aging. I like to look at aging as weather. It's very sunny, but there is that dark cloud. People are living longer, life expectancies are growing, medicine is advanced so much, but we have this dark cloud that is dementia Alzheimer's. And the biggest risk factor to developing it is age. So as people age further, the risk increases. So I find my job very valuable here. I think that research is a good way to go. I'm hopeful that we can find a preventative someday that people can avoid getting this disease. And happy to be here with you today. Could I have the next slide, please? I'd like to go over some resources. I know that Elizabeth talked about support groups. There are many online support groups, and I can't emphasize enough the importance of the Alzheimer's Association. I'm going to be repeating their helpline a few times here. That's 1-800-272-3900. Please give them a call. They're 24/7. They are experts in dementia Alzheimer's. They can hook you up with local support groups. I'm not sure they're meeting yet in person, but they're all over the Chicagoland area and throughout the country. They also have educational programs on demand, and they can walk you through some different topics. I'll give you a few examples: the 10 warning signs of Alzheimer's, understanding Alzheimer's and dementia, dementia conversations. People have questions about should mom be driving? Also doctor visits. They have one on legal and financial planning. A really popular one is effective communication strategies. As you know, communication can be difficult with a loved one as they progress along with disease. And they also have dementia care experts that are available. They're not the ones that answer the phone, but you could ask to speak to a care consultant. Again, their number is 1-800-272-3900. Burnout is very common with caregivers. And if you're in that moment and you need someone to talk to, please give them a call. They understand. They can walk you through real-time scenarios, what to do, even if it's in the middle of the night. And if you don't have a pen and paper, just remember you can Google Alzheimer's Association 24-hour helpline. It'll pop right up, and I can't emphasize that enough. We also work with Dementia Friends here at the Rush Alzheimer's Disease Center, and that is an initiative to make communities dementia friendly. And it's exciting to be a part of that. We have different neighborhoods in the city of Chicago. I believe that Hyde Park is the latest one to join. We're hoping to get more. There are also the alz.org website, and that's just the online version to the 800 number that I was providing earlier. Next slide, please. A new initiative that we have going on here at Rush is called the Caregiver Initiative, and it is actually grant funded, and it's a wonderful opportunity for families to access care planning, and it doesn't cost anything. If you're caregiving for an adult 65 years or older, you would qualify. And oftentimes, families can be sort of spread out throughout the country. If your loved one lives here in Chicago, and for example, you live in Los Angeles, this can all be done remotely. They do really amazing work. They can teach you how to lift properly. They can guide you on catheter changes. They can also recommend a nutritionist, all the different levels of care that we have here at Rush. And it's important because you can have 3 to 4 meetings with a licensed social worker. And the number to call to access that feature here at Rush is 312-563-0350. Again, that number is 312-563-0350. I like to give other options. You can also Google Caregiver Initiative Rush. It'll pop right up. Next slide, please. We are funded here by the National Institutes on Aging, as well as the Alzheimer's Association. Next slide, please. And our government has increased funding in research to find a cure or a preventative. And they see the big need, because if we don't get ahead of this disease, there's going to be unbelievable costs. There already are. And so it's very encouraging to see our government take note of that and to fund some of the research that we do right here at Rush. Next slide, please. How can I help? That's a great question. We have multiple research opportunities here at Rush for both people living with the disease and also people that don't have the disease, that it does pertain to dementia, Alzheimer's. Next slide, please. We are always looking for people to partner with us. Choosing to join a clinical trial is a very personal decision. Some participants want to be proactive about their condition. Some want the opportunity to share valuable insights about their condition with researchers in order to help others who are going through the same thing. Ultimately, the goal of all clinical trials is to determine if a new test or treatment is effective and safe. Most of us in some way have benefited from research without necessarily realizing it. People who take part in dementia research are contributing towards the care, treatment, and well-being of countless numbers of people who have dementia, as well as others who may develop it at some point in the future. They may have different reasons for wanting to be involved in research. If you're interested, please contact us directly. Our number here to get involved is 312-942-0050. And again, the number to be included into our data repository for our research studies on dementia Alzheimer's is 312-942-0050. Next slide, please. One of the clinical trials that I'm recruiting for is preventable, and we are looking for people over the age of 75 who are currently not taking a statin medication and are Rush patients. We're trying to figure out if taking 1 pill a day could prevent dementia in people over the age of 75. So it's very exciting work to be doing, and if we could figure out a preventative that is so easy for people, it would be great. It would be a huge game changer. Another research study that we're always recruiting for is All of Us research program, and I think somebody touched on that a little bit earlier today. All of Us is a health research program funded by the National Institutes of Health. The goal is to help researchers better understand why people get sick or stay healthy. The mission of the All of Us research program is simple: to speed up health research and medical breakthroughs. To do this, All of Us is asking 1 million people to share their health data and samples of blood and urine to build the largest health database of its kind. Researchers can then use this data to conduct thousands of studies. This may help find the next big medical breakthrough. And to be involved in our All of Us research, please do give us a call at 312-942-0050, and that is the same number also to be included for preventable. I'll repeat it one last time. It's 312-942-0050. Next slide, please. And that does conclude our program today. We are going to open that up to questions from the audience.
Okay, thank you guys. That was so wonderful. And I just want to give a really quick reminder that today's program is going to be saved on our YouTube channel. So Michael just went through and had a bunch of phone numbers for you and a bunch of websites to look at. All of that is going to be available to you so you can rewatch this program, or if you're someone who would like to, if you have someone in your life you'd like to share the program, right? Everything will continue to be on YouTube, so you should be able to share it easily. So let's go through some of the questions that we got from the audience. And again, just a reminder, feel free to please type in your question or comments, and I'll read them out for our panel. So the first question was a question about using ABA-based methods, the reminders that are visual prompts. And an example is there are social stories for children with autism spectrum disorder that can be designed for people with dementia and Alzheimer's to help explain recent changes in protocol. So sorry, I said ABA, but I just want to make sure everyone knows that our viewers know that ABA is applied behavior analysis, I believe, right? Which is a type of therapy. So is there a question, or do you have anything to say about using ABA with Alzheimer's or dementia patients?
I'm going to say that I don't know much about that, and I'm wondering if Michael might be able to share some insight of that. I know that some folks do that work. Michael, are you familiar with that work?
I actually am not familiar with that work. That is not something that is widespread in Alzheimer's dementia. But I'm interested in that topic. I just don't know anything about it. There must not be empirical evidence, I'm guessing, on that with dementia, Alzheimer's.
Yeah, and I think I'm not familiar with that particular body of work. I am familiar with that concept as it relates to some other conditions, but I'm wondering if that person that posed that question, and perhaps some other viewers, if they are interested in that, is that something that the Alzheimer's Association might have more information about, and also a Dementia Friends? Would that be a good starting point to kind of get a little bit more information about this and other questions?
Absolutely, that's a great point, Lisa. I would give them a call. They do have experts there that can, if they don't know the answer right away, they can research it. They have a huge library that they have access to. Their number is 1-800-272-3900.
Mm-hmm. That's great. I do want to encourage, thank you, Michael. I do want to also encourage viewers to consider calling them when you don't actually need them in that moment, right? So it's a, as a psychologist, I always advocate for, practicing skills. So getting good at just picking up the phone and, or going to the website and just familiarize yourself. Because sometimes when you really need something, sometimes people can feel anxious. And sometimes anxiety can actually get in the way of engaging in certain behaviors. So, if you can practice it out and get educated in the process, learn some new information, that is a fantastic question. And I hope that they are able to also help you answer and get some more information about that new area
Right.
as it applies to Alzheimer's disease. Thank you.
Right.
Great. And then what are some good tips for people who are looking to share caregiving responsibilities within a family?
Oh, I just realized my mic is already on. Great. Mm-hmm. Hi, I did want to jump in because this was something I have dealt with firsthand. Earlier, I had mentioned how a very dear grandfather of mine battled Alzheimer's for a couple of years, and because of how Alzheimer's tend to progress and how that can sometimes be a very slow progression, his needs, of course, changed over time, and that I think was one of the most difficult parts of dealing with that situation, was how to split those responsibilities as they increased amongst family members. because of course there was that inevitable burnout that was falling upon my grandmother, his wife. And in my humble experience, I think that it comes down to communication, but also taking a step back and looking at what realistically can you do? What is your job situation? Where are people located? And sometimes it can also be helpful to even get an objective point of view from someone such as a neurologist, whomever is helping you through the process of that person's diagnosis, somebody with a professional opinion that may be able to better guide you. But otherwise, in my own experience, I found that just assessing everybody's unique situation in terms of what they can offer, what they can do, is incredibly important, because I know that it can also be awkward even opening that discussion up to other family members, because of course it's a lot to ask for. But just keeping that in mind, I think, is a great way to begin.
I think those are great ideas. And if I can add some more, I will say that to keep to have on hand the information of their primary care provider, to have on hand the list of medications if they are taking some medications, to share with their family members their routine that they are having, because any little change, it could be affecting everything. So to be able to explain what is their routine, and also to share some of the tricks, how it's better to communicate with that person, because everybody's different, and for sure to communicate with patients with Alzheimer's or dementia is very particular for every case.
Yes, great. Go ahead, Michael, please.
Sure. I would just add that it's so important that their loved ones stay in that environment. To drop them off at a sibling's house, that is the worst thing to do, because that gets them out of sorts. Maybe alternate weekends. Sometimes a family member may be in charge of finance who lives long distance. That can be their job. And just checking in on your siblings who are doing the brunt of the work, knowing that you're there for them, to listen to them, can really help. That's all I have to add.
I love those suggestions, and I hope our viewers kind of take that to heart and pay attention to some of the messages that are said here. It can be awfully difficult sometimes and awkward, right, to have that conversation with family members. And the only other thing that I'd add is to just really be honest with yourself about what it is that you are able to provide, and to the degree that it is possible to try to be as objective as possible with your loved ones when you're trying to coordinate care, because people could take it the wrong way or become defensive. And the more that you can talk about, we're all in this together, we all love, the person's name. And I just wanted to talk about the resources that we might all have. And so resources can be anything, as Michael is pointing out, financial resources perhaps, or something else with coordinating care. And so just to kind of be honest, these are the resources that I've identified, which might be the person that's actually providing a brunt of the care, or most of the care, I should say. And hopefully other people will be able to see what may be missing. And again, I think Elizabeth might have alluded to this a little bit, is focusing on what can be done versus what can't be done. That can just be a slightly more empowering, a positive way to kind of look at it, because there is a tremendous amount of help out there, even beyond the family members. Of course, the family is very important. Thank you for that question.
Yeah, that sounds like a really good example too of all of the resources and phone numbers and groups that Michael shared, right? To be able to hear other people's stories and how they communicated and had those conversations with family members. Sometimes it's best to just talk about things with other people who have been in your position, right? So here's kind of another similar question, a little bit about what are the best ways to get quality assistance from the dementia patient's doctor? So I guess it's like communication between the caregivers and the patient's doctor.
I'm wondering if any one of us could jump in with that. I guess they're talking about you're saying the communication, how to improve communication. Perhaps it's along that lines.
Yeah, just quality assistance, right? So to make sure that, like, I guess communication is clear.
Okay.
And that maybe the doctor knows the caregiving situation, or.
Good. Okay, great. So what I would like to add here, and please, if my colleagues also have pointers, we can jump in as well. I guess the point I'd like to emphasize is the importance of coming prepared to those visits. I love that question because it's telling me that we're already getting to be thinking of that doctor's visit may be coming up. So writing down ahead of time the kind of questions that you might have, because in that moment, when you're in that clinical setting, sometimes things can get very confusing, or there's a lot of information all at one time. A person may forget what their questions are just at a basic level. So coming prepared, and maybe sometimes I've heard, and I've also used this as well, talking to the nurse or nursing assistant, a nurse practitioner ahead of time to kind of let them know that, hey, I might have some additional, or I'm going to have some additional questions for the doctor or the provider. That can also help to give them a little bit of heads up that you might need a little extra time there, because your questions are so important. You have a right as a patient to kind of get those questions answered, and as a caregiver, by extension as well. So I hope that is helpful in terms of preparing ahead of time, writing down your questions, and hopefully that will help to prepare for that visit and improve communication overall.
I'd like to answer that question. I think that doctors are very good at diagnosing and maybe prescribing some medication, but actual care planning could be done. For example, the Caregiver Initiative we have here at Rush, and that they can do a very comprehensive care plan that goes years down the road. For example, is mom safe to live in her house? And one of the definitive inevitably is mom left something on the stove and there's smoke coming out of her apartment, and that is time for her to be considered to the next level of care. And that these are questions that people get often, and our Caregiver Initiative at 312-563-0350 can answer that question. You can revisit it 2 years down the road, because there's different levels of care: assisted living, independent living, some people can even be in. And these are really common questions that people get. And also the Alzheimer's Association does a care plan as well. It's not something that you can go back and forth into. They can give it on one conversation. The Caregiver Initiative here at Rush is something you can access down the road, and they can read the notes from previous phone calls. So it can be very helpful, and people often don't have the knowledge. This is all brand new for their family, and to get that guidance is so important, and from people who really know what they're doing and know what the success rates are and what the best paths forward are for people living with the disease. So great question.
That just brings to mind, I think it's so important that often when you're in a new situation, you don't even have the vocabulary to know what to ask for, right? So even something like you were explaining, Michael, like using the term care planning, that's a term I've never heard before, right? So even knowing kind of how to engage with that and ask those questions, that's so wonderful. That's so good. So if you are watching and you still have a question, please type it in, because I've gone through all of the ones that I have seen. So thank you so much. That was just such wonderful ideas and such wonderful information that I think can be so helpful to everyone that's watching, and just great ways for caregivers to take care of themselves. So I just want to say again, please remember that this program will be saved and that you can watch it on our YouTube channel, and you'll also be able to find it through our catalog if you're searching. So I just want to say, on behalf of Chicago Public Library and all of our viewers and all of our caregivers throughout the city, thank you so much to Sophie, Michael, Elizabeth, and Dr. Sanchez Johnson for coming out and helping us learn and answering these questions for us from Rush. Thank you so much and have a good day,
you.
everybody.